Good morning. You're getting all natural, Vicky, this morning. It's kind of early, well, nearly 8 o'clock. I've been awake since 5. Um, I just wanted to check in and just give you the update from my most recent doctor's appointment. I saw my doctor yesterday and we had a good conversation. Just to recap a little bit, that I'd had some blood work about 2 weeks ago. A little over 2 weeks ago now. And after being on the budesonide for approximately a month, 3 weeks to a month, I had blood work. Unfortunately, it was a mixed bag of information, as it seems like I just can't fall into any type of mold as far as what's going on with my liver. So it was a mixed bag. My alkaline phosphatase had actually come down approximately 100 points, which was very good news. The other issue was my AST and ALT had actually risen about 10 points each. So that was one thing I discussed with my doctor yesterday, and he agreed it was a little bit of a confusing and unexpected thing he expected to see. He actually expected to see the AST and ALT come down considerably, and maybe the alkaline phosphatase not as much, but I had the exact opposite reaction. Which was a little confusing to him, but yet he was not deterred. He reinforced to me that no matter what I read about different diseases and processes, that really a lot of things don't fit into a box because all humans are unique and how they react to medication. And this kind of describes both sides of the coin for me. He is of the opinion that I do have a crossover syndrome, but he believes that possibly my crossover syndrome was going back to chicken or egg. He thinks that this all started with a drug interaction in my liver, because that's the way the pattern is playing out, and that's also what my liver biopsy showed. So he said, all the imaging looks great. You're not showing typical signs of PBC, which is the biliary autoimmune disorder. In your liver biopsy showed none of that. It showed more of an autoimmune hepatitis type of pattern with what they call DILI, which is drug-induced liver injury. And it goes even deeper. There's an acronym called IDILI, which is immune-mediated drug-induced liver injury, which he believes that is probably what started all of this with me. We're still not 100% sure. We're still in the process of trying to figure out exactly what's going on with me, and we may never really get a hard diagnosis. Again, we're just trying things now as far as treatment, throwing things at the wall and seeing what sticks. So the budesonide was a little bit of a success with my ALP, alkaline phosphatase, but not a success with the liver enzymes he thought it would be a success with, which is the AST and ALT. So again, about 2 weeks ago, he put me on a new medication, which is the bile salt called Ursodiol. Brand name is what is the brand name? Oh, I forgot the brand name off the top of my head. Anyway, people don't go by brand names as much anymore on a lot of things, and this is they go by the generic. So the generic is Ursodiol, Urso as, you know, as the little short name of it. So we had a really good talk. He was, the doctor is great, and I'm not criticizing him at all. He's an older doc. He's of the older generation. So he's very nice. I don't say doesn't have a bedside manner. He just is, he doesn't coddle his patients, which, sometimes, a lot of us like to be coddled and reassured. He's not the most reassuring doctor. He's just very to the point. He reminds me of somebody I've had in my life. He honestly reminds me of somebody I know and a relative. That's what I'll say. Very nice person, but doesn't, I don't know what the word to say is, doesn't, we won't baby you. Nice, but, is not going to be the person you go to cry on their shoulder. And that's okay. I really don't need that in a doctor. It's nice. And now that I've switched over to mostly female doctors, I get that in most of my interactions. And actually, this doctor's nurse practitioner is probably the most wonderful practitioner I've ever met. I mean, she is just like talking to her girlfriend. And so there's a little bit of the male-female dynamic going on there that, you just deal with. But in a doctor, in this case, I'm looking for somebody with expertise, and he definitely has it. He is in his upper 60s, I would say, maybe 70 already. I don't know. He's going pretty soon into retirement, but I want somebody that's had experience and knows their stuff. And this guy seems to know his stuff. He doesn't get upset about anything, like, some doctors will go, I don't know what's going on, and, this is concerning me and I'm ready to refer you to someone else. No. And he basically told me, he said, I've not had anybody in my practice ever that even if I have to do some consults with other physicians, that I couldn't figure out something. And he said, the only people I've had to refer out are people who are to the point they need a liver transplant. And, I have to refer those to a transplant center. But he said, people with these kind of conditions, I usually can get to the bottom of it. Anyway, I'm rambling, but I'm getting to the point. Anyway, we had a good visit yesterday, and he wanted to assure me that he did reassure me of the fact that we would figure it out. Even if we don't get to a firm diagnosis, we'd figure out what the treatment is. So I asked him a few questions. Just like I stated in my last video, I don't want to get into a medication loop that I can't get out of. And my main question to him was, can we wait to start on immunosuppressant? He said, well, you can't be on the budesonide forever, which is the steroid. And just this past few days, I've been beginning to have some swelling. I'm even noticing it a little bit in my face, but definitely from here down, I'm feeling swelling. I have gained a couple of pounds, which he assured me would most likely, if I'm not eating like crazy, would go away once I taper down on this medication, this steroid. But he was in agreement with me. He's like, no, I don't want to start you on an immunosuppressant, even though I think you'll eventually need to be on one. And that was part of our discussion. He said, I don't want to start it prematurely if we figure out that the Ursodiol is the new medication that I'm taking, the bile salt, is actually helping your liver enzymes to come down. At that point, we didn't know. I did go get more blood work yesterday, and I'll tack that on at the end. So, we discussed the PBC versus the PSC thing, and, and I told him my fears of maybe I have inflammatory bowel disease and don't know it. Maybe I am PSC. He said, I really don't believe you are PSC. He said, I really don't believe you have inflammatory bowel disease, no matter what your lab work said. He said, I said, well, I've read there's a silent inflammatory bowel disease. He said, I've never seen it. In my 40 years of practice, I've never seen somebody have inflammatory bowel disease that didn't know they had inflammatory bowel disease with symptoms, is what he's saying. He said, people with inflammatory bowel disease, it significantly impacts their daily life. And he said, I've never seen an instant where somebody actually had it and didn't have any symptoms, which I don't. So he reassured me on that. He said, the only thing, with PSC, he said, if we cannot get your liver enzymes down, if nothing we do medication-wise brings them down, I would want you to go have some endoscopy. I would want you to have an endoscopic look at your bile ducts. He said, honestly, I don't see that happening. He said your MRI was completely normal. MRCP was completely normal, which was the MRI. He said those things, he said you very rarely ever send somebody for an endoscopy anymore because the MRCPs, the MRIs are so dang good now. He said, and I also asked him about my liver. I said, comparing my ultrasound with the ultrasound of 2 years ago, which showed fatty liver disease and fibrosis, he said, to now with the MRI, he said, oh yeah, he said, improvement. He said, much improvement. And he said, yes, go with the MRI, that your liver is happier now than it was 2 years ago. Even though your enzymes aren't showing it, you're not developing fibrosis, nor do you have fatty liver disease, which my liver biopsy said. He went back, he said, your liver biopsy did not show any fatty liver. And he said, so the MRI is showing no fatty liver, the liver biopsy showed no fatty. He says, you don't have fatty liver disease. So, keep doing what you're doing. And as far as diet and, he said, you're fine as far as that goes. So, I'm trying to think if there was anything else we discussed. It wasn't a very long appointment. He gets right to the point. I get right to the point. I didn't ramble with him like I'm rambling here. Again, this is a video journal, basically, that I'm doing for myself and for others who may be dealing with some similar situation. So he said, I want you to go have more blood work today. He said, I know it's just been about 12 days since you started the Urso, but he said, I'm just curious. I want to see if anything is happening. And he said, if we see a dramatic drop in your liver enzymes, he said, I'm going to tell you, let's wait another month before we even entertain starting you on an immunosuppressant. So went and had my lab work drawn, went and got my dinner, drove home through Charlotte rush hour traffic, took some time to do that, ate my dinner, did a few other things, and I looked on the portal, and there were my blood work was already there. Just had a liver panel yesterday, and the good news is, all good news. I wrote it down here. My ALT came down 31 points, more closer to normal. Still a little ways to go before it's normal. My AST came down 20 points, and it's now 2 points from being normal. So if it lowers 2 more points, it's in the normal range. My ALP had been 333 on the last blood work, had been 417 previously. Yesterday was 239, so it came down 94 more points. So I saw the lab work before he did, but within an hour, again, Johnny on the spot here, and this is something I talked to him about. I said, you are so fast to get back to me on blood work and imaging, and he said, He said, well, he said it's a little bit self-serving. He said, yes, I like to be fast with my patients because I don't want them worrying. And he said, but number two, I don't want my office to get inundated with calls. He said, because if people see something that scares them, automatically we're getting calls and it just creates more workload. But he said it's self-serving in those ways. But he said, I do like to get back to my patients as quickly as possible to reassure them or give them instructions. Yeah, he was on there on the spot with that. But anyway, he told me he was very pleased to see that. And he said, this is a dramatic drop in just a week. He said, usually with the Ursodiol, we're looking at a month or 2 or 3. He said some people even 6 before it brings their ALP down. He said, and it brought your other enzymes down significantly. He said, so I'm very happy. So I want you to cut your budesonide down from 9 milligrams a day, 3 pills, to 6 milligrams a day, 2 pills. And I want you to get retested in a month. And then we'll talk about whether or not we're starting you on immunosuppressant or not. So he didn't outright say it, but he was very happy. So he's of my thought, let's not start an immunosuppressant unless we see we need it. You know, he told me eventually I probably will be on an immunosuppressant, at least for a while. He said if this is drug-induced liver injury or immune-mediated drug-induced liver injury, he said, once we get your immune system calmed down for several months to a year, if we start an immunosuppressant and do that for about a year, then you have more success in trying to do a trial and not having recurrence. Also, I told him that I have stopped the 2 drugs I was on when all this cropped up, which was Zyrtec, and I failed to mention that in my video last week. I'd been on Zyrtec for 3 or 4 years, and also the antidepressant citalopram that I was on. I told him I'm now completely weaned off of those medications. So he also said in his note last night, he said this could be a side effect of getting off those medications if this is DILI, if this is drug-induced liver injury. So he said, keep doing that. Let's see where you're at in a month, and then we'll revisit. So I'm very pleased with that. Very thrilled, actually, that we're on the right path, and that, you know, I am not got some kind of aggressive maybe rare, but not an aggressive PSC or things like that, you know. Still uncertainty down the road about that, but honestly, the picture is starting to line up with what my liver biopsy showed, which is a drug-induced, you know, autoimmune response in my liver, which basically says, you know, the drug caused a reaction in my liver, and my immune system went, oh my gosh, there's something there, we got to go attack. Well, it's attacking liver, not a virus, not cancer, but it's attacking my biliary ducts primarily, which is causing the rest of my liver not to be happy and be inflamed. So, you know, that's what the drug-induced thing. And he reiterated to me, he said, I can look up all these meds that you're on and see that they shouldn't cause liver damage, but every person is different. Like he said, I might be able to take this Zyrtec all day long for years and it never do anything to my liver, but you take it, it's caused this. He said, you know, even aspirin. Some people can't take aspirin because it creates a liver issue, or acetaminophen, or, you know, people just metabolize drugs differently. He said, any medication, anything you put in your body has the potential of reacting in your liver because of your unique chemistry. So, you know, to me, it just reiterates the fact that we should be scared of medication, and we should take the medication we need to take, but we also need to be careful with how our body reacts. And if you start having, say, elevated liver enzymes like I have, go back to your medications. And, of course, consult with your doctor. I am not a medical professional, even though I worked in medicine for 14 years. I didn't work in clinic. I'm not a clinician. So, disclaimer, I'm not a clinician. I'm just someone that really does her research on things. But just always consult with your doctor of could it be medication causing that. And try to keep your medications down to a dull roar. I mean, there's so many people that are taking medications that they need to take. Some maybe they don't, but again, personal between you and your doctor. But there's a lot of people taking medications, then having to take medications to offset the side effects of the other medications. And seeing that's the loop I don't want to get into. There's one particular medication. I'm taking a statin, but I have historically had high cholesterol. I won't go on into that. Kind of scary high cholesterol. But for years, they didn't want to put me on statin because I was reproductive age. But, I kind of don't want to be on a statin, but yet, for various reasons, because my total cholesterols tend to be super high, I felt like I needed to. And now they're down to a dull roar. And that's where I want to be at, because you do need to have, according to my functional medicine doctor and other people, you do need to have certain levels of cholesterol to fight off cancer and viruses, because it has a effect on all of that. I mean, everything in our body, even the things that can be potentially dangerous to our body, like high cholesterol, all these things in our body have a function. Yes, sometimes they get out of control due to diet and environment and other things, but they also serve a purpose. So getting my cholesterol down to a very low level or to zero is not the goal. So right now, I think my cholesterols are where they need to be for good health and not to be damaging to my health. So I'm going to stick with it. But statins, a lot of people can't take statins because of liver issues. So again, bottom line, maybe a drug-induced liver injury, autoimmune, which has caused an autoimmune hepatitis and or cholangitis. Okay, I'm going to stop there because I've rambled long enough, but that's the update for now. Y'all have a good day. Bye.